They are bad guys. Please don't test their patients. We should warn everyone about that danger. If that data leaks, I don't know what can happen to the company.
A spine-chilling message with potentially fatal consequences.
This is probably the first time a cyber attack has led to the deaths, albeit indirectly, of South African citizens.
Triggering an unprecedented crisis in our health system.
I thought COVID was a nightmare, but this has been a completely different nightmare.
It was about just after 10 one night. I got a call, and this guy with a very thick Eastern European accent, speaking very fast.
If that data leaks, I don't know what can happen to the company.
Weeks later, critical elements of public and private healthcare are still on their knees, with no corner left untouched. Dr. Jenny Nash, Eastern Cape District Clinician, leaves early for her monthly visit to the rural clinic.
When I got to the clinic last time, I was, sort of wondering why we couldn't access all of our results. And it was only then that I started to realize the implications.
Visiting every month for the last 18 years, she has weathered many health crises. They rely heavily on the extremely efficient online National Health Laboratory Service to provide healthcare for this community of over 10,000 people.
I wonder if we can't just check to see if we've got a paper result for this.
Normally able to access patient history and pathology results on their phones and computers, they have been working in a vacuum since a cyber attack targeting the country's critical lab services 6 weeks ago.
Okay, so that's another one in June. These are the ones that I would usually now look at and then decide whether we're going to continue the treatment, adjust the treatment.
These patients have been here since 7 in the morning. From here, they'll be sent to a hospital or have their treatment adjusted. But it's a process now made infinitely more complicated by faceless computer hackers.
So now when I've looked at some of the folders waiting for me, it means that you're going to have to just go on clinical suspicion.
In other words, a plot hatched by random cyber criminals somewhere in the world forced clinicians to make unreliable diagnoses, sabotaging public health. Cyber criminals have no morals or boundaries, hacking indiscriminately, singling out healthcare amongst the top 3 targets worldwide. It's hard to conceive criminals would attack a healthcare system, demanding outrageous ransoms, knowing lives are at stake.
More than 1 terabyte of information is stolen. A lot of science projects, financial data.
A recording that left 𝗀𝗂𝗏𝗀𝗃 cold. She'd been in the job as CEO of the National Health Laboratory Service for just over a month. Some people have said that NHLS is like the backbone of public health care. How would you describe it?
Every clinical decision that is made, about 70 to 80% of those decisions rely on pathology. We provide our services to more than 80% of the population of the country. And how many samples do we process a month? Give or take around 12, 13 million a month.
Calling themselves Black Suit, the hackers froze the lab service on the 22nd of June this year.
Everybody just got shut out. We could not access emails, people could not access our systems, and it meant the labs could not operate.
The dotted line is where you think that there's a link.
Cybersecurity expert Dominic White says little is known about Black Suit.
These orange names are names given by threat intel companies. They aren't the names they've given themselves. What happens with these ransomware gangs is they get arrested, they have falling outs, people get sanctioned, so they split up and splinter. Sometimes they rebrand just because there's bad things associated with the previous name.
Dominic is the ethical hacking director of a global cybersecurity company, shoring up defenses against increasingly sophisticated cyber attacks.
They only notify the client to try and exert that extortionary pressure after they've completed the hack. They've managed to understand and map out the organization, ransack all of the data, whether they're deleting or encrypting it.
It is at this point the ghastly message appears, providing a link to begin negotiations.
There was a link that was included in their communication, which the IT people could actually see on the system. But then we were advised, don't you dare touch that link because you don't know what it's going to be opening you up to. So really, from the NHLS perspective, we did not open that link whatsoever. The IT guys
refusing to negotiate, they have no idea what ransom _𝗏𝗀 was demanding.
The cyber security specialists have come on board. CSIR has been assisting us, and we also had a first round, assisting us pro bono.
As the NHLS scrambled for solutions and with negotiations a non-starter, events took a strange turn. Apparently frustrated by the lack of communication, the attackers made a call out of the blue, dragging a local medical journalist into the fray.
I got it, yes.
𝗀𝗵𝗶𝘀, a mere observer to the attack.
It was about just after 10 one night. I got a call, and this guy with a very thick Eastern European accent, speaking very fast. And he said, I want you to give a message to the NHLS leadership, to the CEO, Professor 𝗀𝗁𝗶𝗴𝗶, and we can fix this in a couple of hours. C for Charlie, Y for Yellow, T for Tommy, then the number 5.
Ransomware attacks are increasingly complex. It's a lucrative business projected to cost the world $10 trillion. In 2017, ransomware called WannaCry hit the national health system in the United Kingdom, causing havoc and costing over £92 million. It was attacked again in 2022, costing £40 million. Bizarrely, the crimes of a gang of hackers on the other side of the world is being felt here at a rural Eastern Cape clinic. Normally, you open up your phone and you can track a timeline for a patient in terms of their bloods over time. And it's like it's all at the touch of a fingertip.
Literally, yes.
And suddenly, you're just locked out.
Yeah, a huge frustration where you have a patient who comes in and they might have been seen in another province, and the track lab allowed you to go back and gave you that perspective of this patient. So suddenly the patient isn't almost like a 2D in front of you, they've got 3D, they've got dimension. So you just got that background of the patient.
Doctors are describing it as the biggest single disaster to have hit the public health sector. Online results are critical in hospitals, but results have to be physically collected from the labs, and in chronically understaffed hospitals, it can take 3 to 4 days to reach the ward. Operations have been postponed and patients left hanging for answers.
I think it probably affects junior doctors more. Perhaps they haven't faced lots of challenges over many years and perhaps don't have as much confidence clinically. That can be very terrifying if you don't have results coming back to you.
Okay, that one is done outside of East London. So I will need to take your details so that I can phone you back for that.
Young doctors like 𝗀𝗁𝗶𝗀𝗏 are desperate.
We are chasing urgent results, influencing patients' management. We are feeding and supplementing patients by giving IV fluids and giving treatments, and not always sure what we are actually doing, if we're doing more harm than good. I've been phoning since yesterday for some results, and I've not even been able to get hold of some of the laboratories at different hospitals.
The 𝗀𝗵𝗶𝗴𝗶 laboratory runs 13,000 tests a month. Over and above the hospital, they service 19 facilities from the surrounding area. Having run a state-of-the-art laboratory service, they've been reduced to doing things manually, and it's taking double the time to get results out.
I bought 5 this side. Okay.
Just the customer?
Yeah.
Laboratory manager 𝗶𝗿𝗀𝗴𝗶𝗴𝗶 is exhausted. His staff are torn between processing specimens and communicating urgent results to clinicians.
Previously, you would have just to load the instrument, it would scan all the tests that are requested. But now you have to select each and every test that is requested on the instrument to tell it what test must be processed.
Even if the NHLS had paid the ransom, there were no guarantees the hackers would restore the data. Taking 6 weeks to secure the system, it slowly came back online.
Doctors, in some cases, feel that you didn't do enough, that you didn't set up a hotline exclusively to deal with the results, that you weren't strategic enough with your use of WhatsApp and other alternative technologies.
I will accept it if clinicians feel we could have communicated better. Unfortunately, there is no direct access to clinicians in the public sector. But we really tried to do media releases to all the various WhatsApp groups of doctors that are there for the time being.
So, did the NHLS do enough to protect this critical service?
A lot of the time, people rush to blame the victims. There's no evidence that the NHLS was negligent here. I know that they engage in cybersecurity. And if you think about it, were you negligent or was the attacker just innovative? I would like that to be a bit of a rallying cry with the South African government to embolden our efforts to work with international law enforcement to target these gangs and to put a lot more effort into securing our parastatals, our SOEs, and direct government institutions.
After 6 weeks, pathology results came back online and patient data before the hack restored. After that, it remains a black hole.
If you could speak to the hackers, what would you say to them?
I would actually almost get emotional. No, I feel like it's evil. Yeah.